At age 49, I was diagnosed with triple-negative breast cancer.
Well, they found out after the biopsy that I was an adenocarcinoma, that it was a colon cancer.
When the doctor said prostate cancer, for me it was kind of like a big, dark, gray cloud came over my head at that moment.
When they took the bone marrow, they came back and they said he had leukemia.
Cancer disparities is a complex issue, and historically there's been a lot of work trying to understand the role of socioeconomics, which undoubtedly contribute to a lot of the disparities that we see.
When I had the second breast cancer diagnosis, this is when my problem began with my insurance. My insurance didn't cover the surgery that I was going to have at one particular hospital.
Looked and sought and searched, and I wasn't getting calls back, or I would call clinical teams and they would ask me to send in my medical history. And in 2017, my medical history was 500 pages. I wasn't working at the time. You want me to send in 500 pages via a fax at $3 a page? How archaic.
We are learning that in some cases with equal treatment, equal disease management, we can begin to see equal outcomes. But hasn't always been the case.
I met Dr. Muncie's group in 2009 and was followed by him to 2017 as smoldering myeloma.
Mr. Johnson has been my patient. He has been coming to Dana-Farber for a number of years. Mr. Johnson proves the point that when you get a good access, you could do well.
After the CAR-T therapy, Fernando was, we were at the hotel, he was jumping on the hotel bed, he was bouncing around. I had to tell him to stop because he has low bone density. I'm like, no, you might break something. I basically believe the CAR-T was a miracle for him.
What I'm excited about now is that we have amazing tools and technologies and methodologies that are really allowing us to hone in on biological factors that might be influencing these disparities.
During the time of my chemotherapies, I had to undergo genetic counseling and genetic testing, and I tested positive for the BRCA1 mutation.
My second opinion said to me, you might want to think about genomic testing because you might have mutations that may be driving your cancer. And so all of this information led me to go out there and seek, a trial.
We need to diversify clinical trials, increasing the numbers of minority individuals participating in these trials.
They said, well, we do have a clinical trial that we're looking to get some folks into. First of all, I wanted to see if I could take care of me. And then I started thinking about if I'm in a clinical trial and what I do helps someone down the road, then I've done something. I've paid it forward.
As we look towards 2025 and 2030 is when we begin to integrate the societal issues and how that can affect biology. We've made progress in a number of areas, again, particularly on the biology side, but I still think we have a long ways to go.
As a Hispanic living in Puerto Rico, sometimes we feel that we are a minority inside a minority. I know that there are a lot of programs that need to be created and done. But for us right now, Hispanics living in Puerto Rico, we need the ones that are already currently up and running, we need to get them here.
The African American community, sometimes in these particular communities, they don't have the proper resources. I would say to Congress to try to get some resources out in the community available to the people that cannot afford insurance, that do not have insurance, and to make it available to them.
It's for the generation that comes after, because we don't want to have to live through all these toxicities for the rest of our lives. If we can improve research and we can improve the treatments, I believe it's possible. I think we have really amazing, talented people around. And I think it's important that our elected officials, that they think of us